Assalamu alaikum. This is a case of the CT brain non-contrast for a female patient aged 30 years old, and she was complaining of drowsiness. By scrolling the different axial cuts, we can see there is no intra-axial hematomas or intra-axial space occupying lesions. However, the junior radiologist urgently notified me to assess the study urgently to report it, and he was suspecting a subdural hematomas, putting in mind that there is hyperdensity along the right side of the occipital fossa. However, by doing the multiplanar technique for assessment, we can see that this hyperdensity is matching with an anatomical site of the transverse venous sinus, and it is extending along the sigmoid as well as the straight venous sinus and internal cerebral vein, and by measuring its density we reached 50 and 60 and 80 Housenfield urine at different sites. This is matching with thrombosis, as we know that the thrombus is hyperdense or white, slightly white on the non-contrast CT. The cause of the hyperdensity is the coagulation process that occur inside the thrombus using calcium deposition inside the thrombus, as well as proteinaceous material. All those factors increase the density of the thrombus, which helps us to diagnose the presence of thrombosis inside the vein without the need of injecting any contrast material. Now we come to the negative data that you should mention in the report. No hypodensities in the brain, no hypodensities in the occipital regions, as well as there is no thrombosis of the left transverse or sigmoid venous sinuses or the superior sagittal sinuses. Fortunately, there is no sign of brain edema. The Sylvian fissures are open, as well as the high cortical sulci. To report this case, you will mention that there is increased density of the internal cerebral veins, straight and right transverse venous sinus, as well as the sigmoid. Density reaching 80 Housenfield units suggestive of dural venous thrombosis. For a medical legal purpose, you will mention you need 4 further CT venography, negative data, no sign of brain edema at the current study, no intra or extra axial collection identified, because any non-radiologist who will see the printed films of the study, he may consider this as a subdural hematomas. So you should mention clearly in your report there is no intra or extra axial collection identified. In the description of the video of the YouTube, you will find the link for the DICOM file so that you can revise the study by yourself, and I advise you to do this regularly. And you will find another link to the Word report if you want to have a copy of the report. Good luck.